Hello, I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live in their final years with comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. On today's show, you only have one heart. St. Francis Hospital, the Heart Center, has been the regional leader in cardiac care for over 30 years, providing patients with access to the most advanced, innovative diagnostic and treatment options, as well as some of the country's top specialists in cardiovascular medicine. Today, I'll be joined by St. Francis Hospital's chairman of the Department of Cardiology and the chairman of the Cardiovascular Service Line for Catholic Health Services of Long Island, Dr. Richard Schlafmitz, to discuss everything from common patient questions and advice about how to maintain a healthy heart to some of the most exciting trends and breakout research in the field of cardiology. Stay tuned. We'll be right back with today's heart-centered episode of CHS Presents Health Connect.
Come on, it's not that hard.
My big man fingers are having a problem with these little tiny buttons.
Whoa, watch it there. Your blood pressure's gonna go through the roof.
Tell me about it. I'm trying to learn how to get it down. Instead, it keeps going up.
High blood pressure can increase the risk for heart attack or stroke. Learn how to keep yours at a healthy range.
Ever hear a voice command? Just say text barbershop to 97779.
That's not what I said.
Just give me that. Now my blood pressure's up.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
Hi, and welcome back to CHS Presents Health Connect. Ranked one of America's top hospitals for cardiology and heart surgery by U.S. News & World Report, St. Francis Hospital continues to provide unrivaled expertise in cardiovascular medicine to our patients. I'm pleased to be joined today by the chairman of Catholic Health Services Cardiovascular Service Line and chairman of the Department of Cardiology at St. Francis Hospital, Dr. Richard Schlafmitz. Welcome, Dr. Schlafmitz. Thank you so much for joining us today.
Thanks for having me, Patrick.
It's great to have you here. Now, you've been recognized nationally as an expert in cardiology for many years. Could you share with some of the viewers what are some of the most exciting trends you're seeing in terms of research breakthroughs in your field?
Well, now is a great time to be a cardiologist. You know, it's great to be a doctor, but a cardiologist, it's amazing. Because in the last 5 years or so, the technology advances are just amazing. Being a cardiologist is exciting because we could do things for patients that we could never do before. Things such as replacing aortic valves without surgery. In the past, when you needed your valve replaced, the valve is like a door, lets blood out of the heart.
Yes.
If it got calcified or if it didn't close properly, you needed open heart surgery. Now we actually can replace valves through the groin, mounted on a stent, and have somebody out of the hospital in 3-4 days without going on a ventilator, without any surgical procedure. It's incredible. We have techniques where we can place something in somebody's right side of the heart in the lung, and it measures the pressure inside their body and their output of how the heart's pumping. They go home and they have a little wand that they put on their pillow, and every day could send to their iPhone of their doctor the pressures inside the heart so we can monitor the pressures and keep them out of a hospital.
That's amazing. And you're doing all of this right at St. Francis Hospital.
That and much, much more, Patrick.
So tell me about much more. I know that you are an expert imager, and you've termed the phrase precision PCI, or percutaneous coronary intervention. Can you share a little bit about the exciting work you're doing there?
Absolutely. First, let's backtrack a little. What is angioplasty? What is a stent? The heart is a muscle, pumps blood around the body. There are 3 arteries that give the heart blood flow.
Right.
If you have a blockage in an artery, it limits flow. I usually make an analogy to a garden hose bringing water to a lawn. You have a blockage in your garden hose, you have a brown lawn.
Right.
If you have a blockage in an artery going to the heart, you have a heart attack. So our job is to recognize and diagnose that before it happens. There are various tests that we do to assess it, as well as clinical symptoms. But if somebody has symptoms attributable to a blockage in a heart artery, or if your doctor does a test showing that there might be a blockage, they refer to us for an angiogram. And an angiogram is a test where historically was the gold standard, where we inject a contrast, a dye, and we take a picture on X-ray, and we see if there's a blockage. You're really looking at dye flow through an artery, and you could see if there's decreased flow. But you really don't know what's happening inside the artery in the past.
In the past. How about today?
Okay, so now things have changed. There's a new technology out called optical coherence tomography. It took a while to learn how to say it, so we used the letters OCT.
OCT.
And what that is, we do it during an angiogram, and it's a real game changer, Patrick. What we do is we put a light source inside the artery when we do the angiogram. And instead of just looking at flow down the artery, we're actually looking inside the artery, and we can see to microns exactly what's going on. It blows up the image 100-fold. So I can see the precise length of a blockage of an artery. I can see the size of the artery. So I can figure out exactly the right stent that I need for that patient instead of guessing. And I can tell the morphology. What is the plaque made of? Patients say to me all the time, what is my plaque made of?
Right.
Is it cholesterol fat? Is it calcium? Is it fibrosis? Is it blood clot? Here I can tell you precisely the morphology. And the reason why that's important is because how I pre-treat the vessel before I put the stent in, and the stent is how we finally fix the artery, I can tell what I need to do beforehand. And then afterwards, when I'm done with the procedure, I use this light source, and I'm going to show you some slides how we do it, of how you can guarantee that your result is perfect. So this precision angioplasty, it tells us where to place the stent, the size, the length, and what to do with it.
So that's amazing. So, you know, again, to kind of equate this to some other environments in the non-clinical realm, it's like taking what was the Polaroid image and converting it to high-definition digital image that gives you, as the operator, so much more information, clarity, information about the type of lesion, how to precisely correct it, and you're seeing marked results in your patients accordingly.
The studies are showing that this technology is certainly much improved from angiography. The way I look at it is, do you remember the old black and white TV sets? You saw the
Correct.
test patterns when you were
Correct.
watching Lucy, black and white?
Correct.
Well, this is a Disney color cartoon movie
It's
compared.
amazing.
It really just changes things.
So now, does everybody offer this? Or again, like with anything in healthcare, and I always tell patients, you really need to seek out the right place and the right physician to do these types of interventions. Can you share a little bit about who's doing this?
Imaging has been around for a little while. Prior to OCT, there was an imaging called intravascular ultrasound, or IVUS, which is a very good imaging technique, but this gives you resolution tenfold from that. When people do angiograms, which, as I said, were the gold standard, most people don't do imaging. It's interesting. IVUS, intravascular ultrasound, which has clearly been shown to be superior to angiography, only 12% of people who have angiograms get IVUS. With OCT, 1%, Patrick. 1%. So there's a 1% chance that your doctor's going to do this. He's going to use angiography 99% of the time. Now, it's changing.
Right.
Because this technology is only 2-3 years old, and it takes time to learn it. In fact, St. Francis is very proud that twice a week we have people coming from all over the world. They spend a day with us, and we're teaching them this imaging concept, and we lecture all over the world, and we have conferences about it. So we have huge international conferences teaching people this imaging technique.
So that's amazing. You know, the old adage in medicine, see one, do one, teach one. You guys are the experts, and in fact, people are flying in from all over to meet with you, learn from you, and to think about how they could apply this to their practice.
Absolutely. And we give feedback afterwards where, with technology as it is today, when they're learning it in their institution, after they take it back, they can send us the images, and we can coach them as to the best way to interpret things.
That's amazing. So how have you seen this change in outcome for a patient? Can you share a story about how perhaps without this technology, despite best intentions, you may not have had the best result you wanted because the imaging just wasn't superior like it is now?
So when you fix an artery, I said you do an angioplasty, which is a balloon, but we put a stent in, which is a little metal spring. And stents are great, but there are some complications with stents. Sometimes the blockage comes back. That's called restenosis. Why does restenosis happen? Restenosis happens because when you just look at an angiogram and you see a blockage, you might think that the blockage is a certain length, let's say 10 millimeters in length. But when you look inside the artery, you see the blockage is much longer than 10. And our goal, what we found out in precision angioplasty, is you want to treat normal to normal tissue. So we're putting in longer stents, but less stents, because we know exactly where the length of the stent we need. The other thing that causes a problem is that when you look at an angiogram, you're guessing what the size of the vessel is. You're saying it's maybe 3.0 millimeters in diameter. But here you can measure with precision the exact size. So if you get the vessel to be the right size with the stent, open it up maximal to 90% of what normal would be, and the right length, and you treat the vessel beforehand, knowing if it's calcium, if you have to get rid of the calcium, using a rotobladed technique or orbital atherectomy. So you pre-treat the vessel, you get the right length, the right opening, you decrease the blockage coming back. You decrease restenosis. So what are the complications of stents? You can get a clot formation, and you can get scar tissue, or the vessel doesn't open all the way. This prevents that from happening. So the vast majority of complications related with stents is going to be past history with this technology.
And you've seen complication rates go down, outcomes improve. To your point, really bridging the disease portion of the vessel, healthy tissue to healthy tissue. I'm sure from an efficiency standpoint, things improve, your visualization's better, and outcomes improve as a result.
Yeah, and other things is, in the past, people would say, oh, gee, I have to be on blood thinners for an indefinite period of time.
A big drawback.
Well, with this technology, we're limiting how long we need to keep people on blood thinners because all the things that cause problems, we're getting rid of.
That's excellent. So I know we have some exciting pictures of what we're going to show. We're going to get to that in just a moment. We have to take a break, and we'll come right back for more of CHS Presents Health Connect.
Oh, Dad, wait till you see the bike we got for Jake.
Hearing loss happens gradually with age, making it easy to ignore. Yet most older Americans aren't getting their hearing tested. Untreated hearing loss can keep your loved ones from enjoying what they cherish most.
Dad, can you hear me?
Don't let that happen. Speak up about hearing loss. You'll be glad you did.
Wherever you are right now, right this moment, you've never been closer to saving a child. Every minute, malaria claims another life. But donating just $1 provides a life-saving test and treatment for one child in Africa. $1 given, one child saved. That's the power of one. Save a life now at PO1.org.
When I lost my sight, the only thing I had was reading.
When you discover you have an impairment, it can change your life. So take a little time to find the resources that are going to help you restore what you've lost.
Whatever your needs are, 99.9% of them can be met by the NLS program.
There's all kinds of formats that you can choose from. You can choose from large print or braille or audio.
Just can't recommend it enough. It's a free service. It's amazing how much you can get.
It has expanded my horizon.
And everybody can read the way they want to read using this program.
For more information about the National Library Service for the Blind and Physically Handicapped, Library of Congress, visit loc.gov/thatallmayread or call 1-888-NLS-READ.
I just walked by and I said, "What's happening, guys?" And they told me they were making music.
It's the way you walk, it's the way you talk. I like this music.
They said I could play, so any chance to play at all. You know, that's my life. I love music.
Yeah, that's how we do it.
Hello and welcome back. Today on CHS Presents Health Connect, I've been chatting with Dr. Richard Schlafmitz, the chairman of Catholic Health Services Cardiovascular Service Line and chairman of the Department of Cardiology at St. Francis Hospital, the Heart Center. Rich, one of the things I did want to make sure the viewers at home know is that aside from leading efforts at St. Francis Hospital, you've helped us build out this incredible cardiovascular service line across the whole CHS system. So the quality of care that is delivered at St. Francis and the types of techniques and procedures and care rendered can be also rendered at our other campus as well, such as Good Samaritan, St. Catherine of Siena with its cath lab. Can you share with our viewers a little bit about what you've done to grow that service line and standardized care?
Well, I wouldn't say it's just me, Patrick. I think you had a tremendous amount to do with it, as well as Dr. Gersey and the team. But one thing I want to start off by saying is I've been fortunate enough to be at St. Francis for approximately 30 years. Mm-hmm. And what makes St. Francis great is certainly not just the doctors. We're a little link in that whole system. We have the most incredible staff, nursing, administration, whether it's a security guard, someone at a desk. True. It's a family.
Yes.
And when patients come to St. Francis, whether it's for cardiology, orthopedics, hematology, oncology, whatever it is, they feel like they're part of St. Francis and they never want to go somewhere else. And we knew we had the brand on Long Island and maybe in the country as one of the top places that people have great care. And we have a 6-hospital system. And you and the administrators at CHS recognize that, you know what, we have this incredible system going. Let's expand it. And you developed something called Service Line. I never knew what it was until you told me about it. And the Service Line is something where you took everybody in each area and you had somebody at each hospital pull it all together. And what we've been able to do successfully is the amazing technology that's available at St. Francis is being brought to each of the hospitals in Suffolk County. So if you're a Good Samaritan Hospital or St. Catherine's Hospital, the doctors are great, the staff are great, and now the technology that we've been able to bring to CHS at St. Francis is in Suffolk County. So if you want your Coca-Cola in Nassau County or Suffolk, it's the same thing. You don't have to travel all that way. You're going to get the great care at Good Sam that you will at St. Francis.
Well, that's an excellent description, and it speaks to the brand that we're leveraging and building together. And it's really about putting patients first, which we do. That is our mission. So you mentioned a term called precision angiography and angioplasty. And I would think it would be a great opportunity for you to share and demonstrate some of your work and some of this cutting-edge technology and research now for the viewers at home. So I think you've got some really innovative slides and pictures for us to share.
Hopefully it'll be fun for you to see. So I'm going to start it off here with an angiogram. And if you look up at the screen here, you see a picture of the coronary artery. This is the right coronary artery. And if you look at the middle of the screen, you see that the dye doesn't flow through exactly right there. That's where the blockage is. And that is how 95% of the world operates when they do an angioplasty or an angiogram. You inject contrast into the artery, you watch it flow down the artery, and you look at the blockage. And I remember when my son was growing up, and he would hear me talk to a patient, and they'd say, how bad is the blockage? And I'd say, it's 99% blocked. And he said to me, Dad, is every artery 99% blocked? It's because we used to guesstimate. It was really mild, moderate, or severe, but people like a number. So with an angiogram, you would guess what you're dealing with. But now, with this new technology, with optical coherence tomography, we can do several things. We could look at plaque assessment. Is it lipidic plaque? Is it calcium? Is it fibrotic? We could look at luminal assessment, the exact size of the artery, and we could look at length assessment. And this is an example here that this particular person on the angiogram has a lipidic plaque. What does that tell me? It tells me I don't have to use ablation to get rid of calcium. It tells me that it's going to be easy to expand my stent in that artery. I looked at the blockage. I wasn't sure exactly how long it was. I wasn't sure how big the artery was. But with this technology, I can precisely get the size of the vessel, the length of the vessel, and now I'm going to treat the vessel. And the way I decided to treat the vessel is I'm going to put a stent in, and it tells me exactly the size. I have co-registration, which pinpoints where the vessel has a blockage, where I put the stent, the length of the stent, and the size of the stent. And then here is a picture of the artery, and if you look carefully, you can see there's some arrows there which direct me and say, okay, put the stent right here, and you're going to have normal to normal tissue. So that's the treatment. Now afterwards, I'm going to want to see, okay, did I have a really good job? And now I get post-assessment where I'm going to look to see, is there any malapposition? Are the stents against the wall? Is it completely open? Is there any dissection present? A dissection is sort of like if you have a hot slice of pizza and you burn the roof of your mouth and skin hangs down. Well, when you put a stent in, at the edges of the stent, it's possible to have a flap. So you want to make sure you have no dissection. You want to make sure you cover normal tissue. And this, as you could see by this slide, it lets me see that. Now I look at my angiogram, and I see that that blockage that was there before, I see it on the angiogram, and I see it that I have an excellent result with a wide open vessel. And then I just assess that. We call that precision PCI. And when I finally look at it, I could look through the vessel and see that the beginning and the end of the vessel has exact lumens where it was, and this is the final angiogram. So just taking you through this, in a matter of minutes, now this takes actually 30 seconds to do the actual technology. It takes a couple of seconds to interpret it, but with this technology, I can get precision angioplasty every time to guarantee the best result. And I like to put this slide up when I talk. Who do you want to be? Do you want to be Clark Kent or Superman?
Yeah, wow. So that is really some impressive work and really shows how far the technology has come. But again, it's also about in the hands of the operator. And I think when I look at the number of interventions, and I think you had shared with me, you performed over 3,500 coronary interventions to date, a tremendous amount of volume. And with that volume becomes expertise. So again, great technology, but assisting the right people in the right hands. So Dr. Schlafmitz, thank you so very much for joining us.
Thank you.
We'll be right back for my final thoughts and my health tips and solution of the day. Please stay tuned. And now, some final thoughts on our discussion today regarding taking charge of your cardiac health. You've heard me say many times, it's crucial to get the right care in the right place by the right people at the right time. I can think of nothing more important when it comes to cardiovascular health. Who you choose and where you go for your care, your intervention, your surgery can make all the difference in the outcome. So do your research. Check the publicly reported websites. Seek different providers. Ask questions of your providers. Ask for references. Ask to speak to some of the patients who have been cared for by a provider you're seeking to get care from. You'd be amazed at what you find. I'm very proud to say that if you speak with a CHS patient, someone like a patient who's been treated by Dr. Schlafmitz or any member of our cardiac services team, you're going to get some wonderful responses back. So please be proactive and get those aspects in place before you actually go in for the procedure. And now for my health tip and solution of the day. I want to talk to you today a little bit about moving care from being reactionary to being proactive. How many times, and we all hear these stories, where someone who we think is healthy dies of a massive heart attack or has a significant cardiovascular event without having any symptoms. It happens still all too frequently despite the incredible technology and outcomes and procedures we just saw demonstrated by Dr. Schlafmitz in his slides. What I would implore in you is don't wait for you to have symptoms before you seek care. Think about when you were younger and you were seeking care as a child in the pediatrician's office. You had preventative wellness visits. You got things checked out proactively. You prevented a lot of potential harm. Then we move into adulthood at the same time that we're actually increasing our risk for chronic disease, and we're lucky if we see a provider sometimes once a year or only when we have symptoms that worry us. Don't take that approach to your health care. Be engaged, get in for your annual wellness visit, get things checked out proactively. Today, there are so many non-invasive either blood tests or diagnostic tests that can pick up and recognize disease earlier that allows you a better outcome and intervention. So again, move from being reactive to proactive and you'll have a much better outcome in your health and in your life. If you'd like to know more about heart health or St. Francis Hospital's cardiovascular care, or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the care of tomorrow. Thank you for watching today. If you have any medically related questions that you'd like for me to answer on future shows, please drop us an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.